into account normal aging. Normal aging is a thing. When the brain ages normally, it loses neurons. It loses capacities. It loses it in a certain way that is somewhat different than the classic dementias.
Right.
Just to kind of give you some examples, when we think about normal aging, memory's affected, cognitive skills are affected, language is affected, attention is affected, but it's all more mild and not of a classic pattern that you would expect with an Alzheimer's-like condition, for example. So memory. In Alzheimer's, it's affecting everyday memory, recent or memory that is what a lot of people would call short-term. Things you just learned, talked about, ate, did, events, declarative things that you're doing, episodic things that's going on in everyday life that you're forgetting from one moment to the next. You might repeat yourself in a condition that has Alzheimer's and not know that you've just repeated a story or a question. Those would be classic signs of the extent of memory deficit, the extent and kind of type of memory deficit in Alzheimer's. But memory decline with aging is common. It happens. It's a forgetfulness. It's a tip of the tongue phenomenon. It's searching for that word or that thing that we did. I can't remember in the moment, or that name of that person, or what is supposed to. Why did I come in this room in the first place? What was I going in the refrigerator for? And it just is not there in the moment. But you leave the area, and boom, there it is. You come up with it eventually. That's classic for memory decline as a factor of normal aging. Whereas if it's gone, the memory for that thing, especially short-term things, recent things that just happened, is gone. That's a little bit more worrisome. That would be the difference there.
Can you give us, let me interrupt you, give us a little bit, something a little bit more concrete instead of it's gone versus it's not gone, you kind of get it back.
Yeah, so let's say I've got some things I wanted to do today, talk to my wife, and we agree that, I should go shopping and grab milk for the baby and a few other things to, make dinner tonight. And so I leave. I didn't make a list. And I get to the grocery store. I'm like, oh, my God, what was I supposed to get? Obviously, milk, I'm there. But what did we want to make for dinner? Was it fish? I can't remember. And then I just kind of rack my brain a few more minutes. Maybe let me go get the milk. I get the milk, and then I'm like, oh, yeah. Okay, it was, fish and salad and some other things that we're going to get. And that would be normal. That would be normal for a distracted brain with a young child who's got a lot on their plate. That would be normal for normal aging with no distractions. It'd be normal for somebody who, was dealing with trauma or chronic pain or something like that. Distractions steal resource from the frontal lobe, being able to handle those kind of demands of everyday life and retrieve memories that were stored normally.
Yeah.
But when the individual, let's say, goes into the store and completely forgets the conversation ever happened. Wait, why am I here? Why did I even come here? I don't remember. And goes home. And
doesn't grab anything.
Is reminded, maybe grab something.
Maybe grab something because they're there.
And goes home and is reminded by, let's say, his wife, honey, did you get those things that I asked you to get? Oh, no, I didn't. And would have forgotten the conversation. And so that would be the difference. It's gone versus it's recoverable with some skill and tactic and decreased mitigation of distraction.
Texting the wife.
Right. Well, you could deploy that activity, and that would be a completely reasonable workaround, which
Right.
in cases of dementia, you should be able to use.
Right.
I just hit a few more, just because I think it's interesting to think about normal aging versus dementia. I think
it's
everybody wants to know that.
It's important because I hear this all the time especially with my concussion patients and my PTSD patients. They complain about these things very similarly, but I don't think it's to the degree that you're trying to communicate, which is, I have no idea why I'm here, and then you just go home because you don't know why you're there.
Right. I would argue, though, a sophisticated. I'm now putting myself in that category, but a sophisticated neurologist, somebody who's thought a lot about this and seen patients on both sides, reversible and irreversible, should know that it's a severity thing, a severity of the issue. The memory for that thing is gone versus it's retrievable with effort. That's the difference between something that's reversible or due to aging, normal aging, versus dementia. It's gone in dementia, specifically Alzheimer's, but it's retrievable with effort in something that's reversible. But a lot of patients, I think, would argue, no, doc, it's gone.
Right.
Right?
Yeah.
But I still don't feel that based on the clinical scenario, this is a neurodegenerative phenomenon. And so beyond severity, you're looking at the pattern.
Right.
Okay, is it that they're just forgetting the things that they just heard about, just experienced, just learned, just wrote down, and don't have in front of them, which would be classic for a neurodegenerative phenomenon to the hippocampus, for example, in Alzheimer's, but would not be classic for something that affects the frontal lobes, like sleep apnea or depression or anxiety or post-traumatic stress. And so in those cases, it would actually be, Doc, I can't remember a lot of things. And in fact, it's not just recent things. I forget things about my childhood. I forget things about, last year. There was a whole period of time where I just have a complete blank of where I was and what I was doing. And that's atypical. That's actually pulling from all different types of brain regions and storage centers all throughout the brain, rather than the use of the hippocampus discretely, which has a vulnerability to Alzheimer's pathology. And so the pattern in that case tips me off. We're going beyond short-term or recent memory, episodic memory, into other categories of memory that if the brain doesn't have resource, if the brain is overly distracted or overwhelmed with emotion or mood or anxiety disturbance, that could cause these major disturbances. The severity could be high, but the pattern is just different.
Yeah. Certainly we're speaking to neurologists and other healthcare professionals on this thing, but I really want to be able to communicate the differences to people that might not be in the healthcare field, that might not be physicians. Like, when should I actually be worried about this as it relates to a neurodegenerative condition? Yeah.
Well, I think if you're having any problems, you should be concerned enough to go to somebody.
Right.
So it's hard for me to say, because of the way I see you and the way you're functioning in everyday life, that it's not a problem. I've never seen a patient where I've been able to pull that off. No, it's not a problem. You're doing fine. Well, doc, I don't feel fine, and you didn't know me before. And where I functioned before was very high level. Yeah. Where I'm functioning now, even though I'm acing these tests, is not where I used to be, and I don't feel normal.
Yeah.
There's nothing I have nothing to argue in that case, and so I wouldn't make that argument. But I would try to address the pattern of difficulties that they're having to see if it fits a neurological pattern rather than something that's more global. A global pattern would be like it affects not just short-term memory, but other forms of memory, remote memory, working memory, trying to hold things in mind for periods of time. Yeah. People with Alzheimer's could do remote memory, right? They can still play the piano if they learn that, or rote memory in that case. They could still do procedural things like brush their teeth and shave their face and make a meal and stuff like that. Learning something new, though, no.
Yeah. Let's circle back to age-related degeneration of the brain or volume loss. I think it's really important because I have tons of patients. We do an MRI of the brain, and in the report, it's age specific volume loss of the brain. Yeah. And they get the report before they see me, and they come in freaking out, like, why is my brain shrinking? They're like 75 years old. I think that what's important to note is that degeneration of the brain happens naturally. Yeah. Right, and we see that on MRIs of the brain.
Volume loss for sure. Neuron loss over time.
Would you not say the term degeneration?
I don't know if I would. I don't know if I would. But I would definitely say volume loss. You're losing neurons, and over time, that volume loss is observable. But again, we go back to pattern. In that case, what I would expect if this was normal aging is proportionate for that person's age. There'd be volume loss, but it'd be global. Yeah. It'd be across the whole brain, not in a pattern that fits a circuit. Right. Which I'll just throw it out there now. The phrase if it fires together, it wires together, meaning if there are brain cells that are firing together, active together as a team to perform a function like language, listening, comprehending, and then speaking to react to a conversation, that's a network. That's a whole circuit. Yeah. If it fires together, wires together, means it functions as a circuit, and it does that in a developmental trajectory over the course of experience and time. Right. But the next part of that phrase that we're learning in dementia, if it fires together, it wires together and dies together. And so it's thought now that dementias or neurodegenerative forms of dementia are circuit or network related dementias. They fit a pattern of atrophy that's specific to that neuropathology. So for example, the memory circuits and visuospatial circuits that take up the temporal lobe all the way up into the parietal lobe are the ones most commonly hit by Alzheimer's forms of dementia. Whereas in frontotemporal dementia, it's the frontal and temporal regions. And in dementia with Lewy body, for example, it's the more parietal occipital regions that become atrophied. So those would have a specific pattern of atrophy, and depending on how far along they are, could be more severe atrophy than you expect for age.